Tomorrow, December the 1st, marks World AIDS Day, an annual opportunity to rally for renewed commitment to improving access to HIV, health services and awareness. It also marks a global commemoration for all of those affected by HIV and remembering those who passed away due to HIV and AIDS-related illnesses. For more on this, I'm joined by Dr. Yogan Pillay. He's the Deputy Director General for National Health Department. He joins me from our Pretoria studios. Thanks so much for your time on SABC News. So, on the eve of World AIDS Day, talk to us about those UN 1990 goals and how South Africa is trying to meet them.
Zinga, good evening, and good evening to the viewers. And thank you very much for having us on the show. Yes, indeed, tomorrow is the 1st of December and it's World AIDS Day. And this year's theme is Communities Make the Difference. And the reason for that, Nzinga, is that, without communities and the participation of communities, civil society organizations, families and individuals, we wouldn't be able to get around the problem and decrease the number of new HIV infections and put people on treatment and support people who are HIV positive. So, we really have been working with communities through the length and breadth of the country to get them more involved. The targets that we have set have been set by UNAIDS, which is a UN organization that coordinates the global response to HIV. And we've come up with the 90-90-90 targets. And this means that for South Africa, we need to have 90% of South Africans who are HIV positive knowing their status, 90% of those that know their status being on antiretroviral treatment, and 90% of those that are on treatment should be virally suppressed. It's very important that people get on treatment as soon as they're diagnosed HIV positive and that they stay on treatment, because what we know from the science is that if people are virally suppressed, they cannot transmit the virus to their loved ones. And that would also help the individual being better, feeling well, being healthy, because they're on treatment, and also their loved ones. They won't be transmitting the virus, and we will be able to decrease the number of new infections in the country. So we've come up with a slogan called U equals U, meaning untransmissible equals undiagnosable. So if you know your status, you are HIV positive, know your status. If you're on treatment, you will not transmit the virus to anybody else. So it's very important that people take the treatment and stay on treatment.
Talk to us about this new antiretroviral treatment, TLD.
So the minister on Wednesday this week launched TLD, which is a new fixed dose combination. It's 3 different medicines in one tablet, taken once a day for the rest of your life, because it's a chronic disease. And it's different in a few ways, Nzinga. The first is that it is more tolerable, which means that there are fewer side effects. The second is that it is affordable, so it's a bit cheaper than the current regimen. The third is that it reduces the viral load more rapidly, which means that people get to viral suppression more quickly, which means they can't transmit the virus. And fourth is that it is less responsive to resistance, because the HIV virus mutates, and as it changes, you can get resistance to the drugs. Now, this drug takes a much longer time for the virus to be resistant to it. So those are the 4 things that's really good about the drugs. And as I said, the minister launched it on Wednesday, and we are now rolling it out throughout the country between Wednesday and February next year. All provinces and all facilities in the country will be providing this new TLD medication.
Talk to us about, there was also concern when people are on treatment about the side effects that you've said have been reduced. Is it to the point where it would be like taking medication that's perhaps on like a very low schedule, where you don't have to worry so much about what you eat or the side effects that are going to come as a result of taking that TLD?
Well, that's the positive thing about the TLD. It's different from the current regimen called TEE, in that one of the drugs in TEE, called efavirenz, does result in things like hallucinations, at least in the beginning of the treatment. They are short-lived, these side effects, but initially when you go on them, they do give side effects such as hallucinations. The new drug with dolutegravir in it doesn't. So that's one of the advantages of this new TLD combination.
Dr. Pillay, there's obviously a concern, particularly in South African hospitals, when it comes to stockouts, and doctors across many provinces raise this as a concern when it comes to you can have a treatment like this, but are there going to be consistent supplies and no running out of this medication?
So that's a very good question, Zinga. And of course, we have to be worried about stockouts of any medication, not only the new medication, TLD. We have 8 suppliers currently who supply the drugs, so we don't anticipate supplier problems. We have ordered the drugs already. They are already in depots, and we will then get them to all of our facilities. The key issue is for our clinics and hospitals to ensure that they order the drug and timeously, so that they don't wait until the stocks reduce quite dramatically before they order. We are keeping a close eye on the suppliers to ensure that the suppliers who are outside of the country, for the most part, do bring in the stock in time, and then we can supply the stock via the depots to our facilities. So we're keeping a close eye on stocks of all kinds, whether they are antiretrovirals or not, whether they are contraceptives or not. It is a big issue for the department, and we are keeping a close eye on it.
Okay, another big issue is that women are disproportionately affected by HIV. UNAIDS says about 62.7% of adults living in South Africa with HIV are women. Talk to us about how the department approaches that, if in any way, when it comes to treatment and other surrounding issues.
So the good news is that if you look at the 90 targets, we've reached the first 90 for women. We are getting the women into our facilities. They are coming in for 2 reasons largely. One is for contraception and family planning, and the second is when they come in for antenatal care when they're pregnant. So women are coming in. The challenge, Nzinga, is to get the men and young people to come to our facilities. Men, as you know, don't go to facilities for any reason. They have to be at death's door before they come and seek health care for any reason. Whether it's diabetes, hypertension, the cancers, TB. We are seeing men coming in rather late. And who's infecting women? It's the men, right? In South Africa, it's heterosexual sex for the most part, with some MSM as well, of course. But it's men that are largely infecting women. So we have to find these men. So this is really a call from the Department of Health to get men to test for HIV. If they test positive, to go on treatment as soon as possible and to stay virally suppressed. This will also decrease the number of new infections in women. And the same applies to young people.
Dr. Pillay, could you speak to us around the statistics and gathering of information around HIV and AIDS in South Africa? There seems to be different statistics regarding people who are infected and affected, and there also seems to be different numbers when it comes to people who are accessing treatment. What numbers do you use, and how do you use those to try and do your work?
So in 2016, Zinga, we had a national survey done by the Human Sciences Research Council, and when they published their data in 2017, they estimated that we had about 7.9 million South Africans who were HIV positive. So that's the number that's the most reliable number, 7.9 million South Africans of the about 58 million South Africans who are HIV positive. So the majority of the population is HIV negative. Now, of those 7.9 million people who are HIV positive, we have about 5 million who are currently receiving antiretroviral treatment. Of those, 4.8 million are receiving it in the public sector, and the balance are receiving treatment in the private sector. Now, if you look at the number of new infections that we had in 2018, these are people who got infected in 2018, then the number is about 220,000. And that is a large number. And if you look in that population, in adolescent girls and young women between the ages of 15 and 24, in 1 week we have about 1,400 new HIV infections. Now that's come down from about 2,000 in 2014, but I think your viewers and yourself, you will agree with me that this is way too many new infections in this young population. So we are focusing on young people, and as I said, we are focusing on getting the men in, because the men are in large part infecting women in the country.
Let's talk about the mother-to-child transmission and those figures. I'm seeing that they've decreased from 8% in 2008 to 0.74% in 2019.
You got the numbers right, Nzinga. So that's one of our success stories, as it turns out. So, without any treatment in 2004, there were about 30% of newborns, of children being born HIV positive. If you fast forward to about 2008, 2009, that came down to about 8%. And if you look today, it's under 1%. So it's one of our success stories. So we've reduced the number of infants being born HIV positive from about 70,000 a year in 2004 to less than 4,500 in 2018, 2019. Now, again, 2,500 is still way too many, but it's significantly lower than the 70,000 born HIV positive in 2004. So it's one of our success stories, I can say.
Okay. UNAIDS says that South Africa has the highest percentage of the population, if I have it correct, 19% of the population affected by HIV. Is that correct? And obviously you're speaking about certain behaviors that need to change. So I'd also like to find out how the Department of Health works with other departments in order to make sure that this is dealt with, because it's not just a problem for one department.
No, you're absolutely right. UNAIDS suggests that about 20% of the world's population who are HIV positive are in South Africa. So, that's a large number, and that's the reason we have the largest antiretroviral program in the world. And we are spending, and this is, to the credit of the government, much of the resources that we are spending comes from the national fiscus, from our national treasury. So that shows the commitment of this government to deal with the HIV epidemic. With respect to your second question about other government departments being involved, we have the South African National AIDS Council, which coordinates the activities around HIV, TB, as well as sexually transmitted infections in the country. And all government departments participate in the South African National Health Council, National AIDS Council. And that's where we do our work together. That's where we coordinate our activities so that there is synergy across our departments. From the Department of Health, we have very good working relations with the Department of Social Development. They take care of the orphans in the country, and a significant number of the orphans are also HIV positive, and they need to be treated. And we work with the Department of Basic Education, for example, to have life skills programs in schools, and we have our school health nurses going to schools to also look at and promote health and safe sex behavior. And we're going to start with the Department of Basic Education with a condom promotion program in high schools as we get permission from the school governing bodies. So we're working quite closely with various government departments, both bilaterally as well as through the South African National AIDS Council.
Talk to us about the programs that are set to run tomorrow when World AIDS Day is commemorated in South Africa. So the Deputy President would be leading the World AIDS Day events tomorrow. There will be visits to homes of people in the area just outside Klerksdorp. The event will be at Klerksdorp, just outside Klerksdorp. We have World AIDS Day in different provinces each year, and this year we decided that we should focus on the Northwest and Dr. Kenneth Kaunda district in particular. So we will be going there. The minister, various ministers will be there, deputy ministers, civil society leaders, leaders from labor, organized labor, as well as business. And to show the commitment of all sectors to getting ahead of this challenge, so that by 2030 we can say that HIV and TB are no longer public health threats in our country. And we can only do that by working with communities as well as working with the different sectors in society. And that's really what tomorrow is about, is to galvanize society and really mount an enhanced response so that by December 2020, we will reach the 90-90-90 targets everywhere. Now this week on Wednesday, the minister announced that 3 districts in KwaZulu-Natal, Ugu district, Umzinyathi, and one other district,
met the 90-90-90 targets. So we are hoping that by March next year, another 14 districts will reach the 90-90-90 targets, with the remainder of the districts reaching the targets by December 2020. If we do that, Nzinga, we will make a significant dent in both the number of new infections in the country, as well as moving to getting as many people who are HIV positive on treatment and keeping them virally suppressed. Really, that is the goal that this country needs to reach if we want to decrease the threat to families, individuals, and society at large from the HIV epidemic.
Dr. Yogan Pillay, Deputy Director General at the Department of Health. So thanks so much for your time on The Full View this evening. It's time for a short break.